Rickey Smiley Morning Show. Hey, ladies and gentlemen, y'all please help me welcome back to the show this morning out of Los Angeles, America's favorite nurse, Nurse Alice Benjamin.
Hey, good morning, everyone. Good morning, good morning.
Nurse Alice, good morning. How you doing? Thank you for joining us.
I am doing well. I'm blessed. It's a wonderful day.
We happy to have you, and now you have more than 23 years of experience as a nationally board-certified clinical nurse specialist and a family nurse practitioner. So we want to ask you some of the questions that we've been getting from our listeners who are parents and caregivers concerned about their kids and COVID. Now, the question that I have is hospitals around the country are reporting nearly 2,000 pediatric patients hospitalized with COVID-19. Why are kids getting sicker than previously, right? Like, is it the Delta variant or what? Because it wasn't like that before.
Yes, it was not like that before. It is, part of it is due to the Delta strain. And then now we have kids back into the community, back in school. And a majority of the kids are unvaccinated or not eligible to be vaccinated. So they're getting around people who are, contagious adults. They're getting it from the adults. And, so we're starting to see more cases. And actually, kids are now 19% of all new COVID cases. So just because they're out in the communities now, we're going to start to see more kids get sick. And so we're going to have to do a lot to try to prevent that, Rickey.
Oh, wow.
Well, speaking of preventing that, I see that Moderna just started enrolling kids that are 11 months old and older in a clinical trial. So as a parent, would you enroll your young child in a COVID vaccine trial?
Ooh, that is a good question. And, even though I am a healthcare provider, I'm a parent also. That's something that I have to sit with and really think about. And I think everyone's entitled to do that. Just so you know, there's nothing wrong with having hesitation and participating in research because you want to protect your babies, but then you also want to protect your babies, right? Hopefully giving them access to this. And, it's a little bit scary, but I think we've seen a lot of deaths happen. I think we're seeing more kids to get sick, and there are definitely parents out there who want to be first in line to get their children protected. And with Moderna starting this, so, they're enrolling kids in their trials. These kids will get vaccines that are half the dose of what the adults are getting. And then for those who are below the age of 5, even less of a dose. So, they're going to enroll. They're going to be followed up for 2 years. But if you're asking me if I would participate, I'd have to think long and hard about it. I want somebody to participate, right? We all want somebody to do it.
Right.
So somebody's going to have to step up.
Exactly. So, Nurse Alice, along that same train of thought, you talk about kids under 5. What about the kids 5 and up getting the next vaccinations? What's your thought on that?
Yes, so it's anticipated that the next round of vaccines, Pfizer's going to be releasing some data actually next month on this, Pfizer will, and we anticipate that children between the ages of 5 and 12 will be eligible and get a vaccine before the end of the year. That's what's anticipated because they've already been doing a lot of work. Pfizer's kind of been in the front doing this, and they claim to have already studied so many kids, so we'll be seeing that soon. And we anticipate it's going to be half the dose of that of adults. Kids, at 5 through 12 years old, these are the kids that are actually that we're seeing with the multi-system inflammatory syndrome. So that's it's going to be a really important age to get vaccinated because we're seeing more of those cases in that age range of children.
We're speaking with America's favorite nurse, Nurse Alice Benjamin, and there have been reports of people trying to buy breast milk. And I say that because the question is, can breast milk from vaccinated moms provide antibody protection for babies and toddlers?
Yes, it can. So when mom gets the vaccine, mom has all of this, developed her immunity and her system is to help her fight off COVID. And so when mom breastfeeds, research has shown that the antibodies spill over into the breast milk. And so we know that children in their first 6 months of life are still developing their immune system. So they're a very vulnerable group. So for them to now be able to get some protection, some of this antibodies from mom is really helpful. And especially since even when we roll out all of these vaccines, we know that newborns to 6 months are not going to be eligible for vaccines. So if they can get this protection through mom's breast milk, that's going to be best for them.
Now, what vitamins or nutrients can parents give young kids to help strengthen their immune system to prevent illness? I can't talk this morning. Sickness during this cold and flu season. And we also the second part of the question, we keep hearing about the multi-inflammatory syndrome in children becoming more common in kids due to COVID. What are some of the warning signs?
Yes. So with the multi-system inflammatory syndrome, we've had 4,400 cases in the United States, mainly between the ages of 5 and 13, and 63% of them Black and Latino. So it's hitting our communities the worst. So it's a rare inflammatory disease that just basically attacks all of your organs, inflames everything. So it's really bad. Now, it's rare, but when it happens, it's pretty bad. So we want to protect our children from this. One of the ways is to, keep them as protected as much as a bubble as possible. But there is treatment for it, and a majority of kids recover. So that's one thing. Parents need to be on the lookout for that. And so when it comes to protecting our kids, how do we do that? We always there was a magic pill, right? Now, I'll say this. Multivitamins are helpful. Now, we don't want to just start giving our kids a whole bunch of, pills from Trader Joe's or anything like that. But having them eat a well-balanced diet, foods that are rich in vitamin C, zinc, calcium, magnesium, vitamin B, iron, omega-3 fatty acids. So all the things we should already be eating before COVID, making sure they get plenty of rest. Rest is very important for your immune system, and keeping them around sick people and trying to make sure that everyone around them is vaccinated and that they're wearing their masks. So, those are the things that we can do to protect our kids. But I think the most natural way, I would give them a multivitamin over the counter, but just making sure that they're eating all of the good foods and try to actually take away some of that, the junk food.
Right.
The junk food can actually be damaging to the immune system.
Nurse Alice, thank you so much for all of this information because, people are going back to school and getting up so early to talk with us this morning. For those who want more information, or how they can follow you on social media, how can they find you?
I'll make it easy for everyone. Ask Nurse Alice. My website's asknursealice.com, and I'm on all social medias at Ask Nurse Alice. Ask me a question. That's what I'm here for.
There it is. Thank you so much because we know it's early out there in LA. Y'all give it up for Nurse Alice.
Yes, indeed.